Hi, I'm Jaden.
I'm Evan.
I'm Casey.
And I'm Ashley, and our LIA project is on mental health accessibility in universities. Mental health accessibility is a critical issue, particularly among university students with barriers like inadequate insurance, provider shortages, and stigma limiting care. In the US, over 21% of adults experienced mental health illness in 2020, and more than 60% of college students met that criteria for a mental health problem. Similar challenges exist globally, as seen in Spain and Canada, highlighting the need for innovative cross national solutions to improve access to care.
So first we're going to look at a historical perspective of the issue and go back to the early 1900s. So at this time, the mental hygiene movement started in the US, and it was basically a fight for improved care for people with mental disorders. Eventually they sort of switched to including like preventative care for mental health issues, and also included like less critical mental health issues besides like mental disorders. And this movement led to the creation of the World Federation of Mental Health, and the World Health Organization began to include mental well-being in the definition of mental health. And more recently, mental health has been seen more as like a state, or from like a state to a field or a discipline. So there's mental health professionals, and we've been trying to distance mental health from psychiatric hospitals and give it more a community focus. So we can see this with the World Health Organization annual report, which includes like policies to break down stigma and discrimination around mental health issues and provide adequate funds for prevention and treatment of mental health issues.
All right, so with the importance of mental health, it's obviously overlooked, and it's the annual increase is 13% each year. When it comes to factors, technology and social media are the main ones, such as like Instagram and TikTok. And there's quite a lot of positive trends, such as digital therapy, focus on work-life balance, and increased awareness. When it comes to negative trends, there's a rising increase in anxiety and depression. Overall, the impact is just technology and societal changes, and just persistent challenges. Overall, though, there's effective strategies and support such as community and therapy, and there's a focus on holistic approaches.
So, as for the context of this issue, as it's kind of been mentioned, mental health accessibility, especially in universities, has kind of been a rising issue around the globe for years. But due to the proximity to us, we chose a more local level, with the US being the University of Minnesota, due to the fact that 60% of college students are diagnosed with at least one mental illness. And even though this is the case, the U of M has resources such as student counseling services, Armwell, Learn to Live, Let's Talk, Effective You, and Pause. But with all of these resources, Boynton Health has found that 42.2% of students report having a mental health condition. And so this is just kind of show that the ratio, especially there's been certain stories from the Minnesota Daily showing that it takes months for kids to kind of receive the resources that they need from the U. So that's just kind of to show the issues of the resources that we have to the students that need them.
And in regards to the SDGs, goal 3 specifically relates to our issue of mental health accessibility. Goal 3 is to ensure healthy lives and promote well-being for all, and it has a little sub-goal of promoting mental health and well-being. And how the UN measures their progress toward this goal is by suicide mortality rates. And the most recent progress report was done in 2019 and said that suicide rates globally had declined by 29% from the year 2000 to 2019. And so what are they doing to reach that goal of ensuring well-being for all? They limit access. Their goal or action plan is to limit access to means of suicide, teach socio-emotional coping skills, follow up for those affected by suicidal thoughts and behaviors, and support key stakeholders like mental health professionals and NGOs that provide mental health services in order to raise awareness and reduce stigma around mental health. And a leadership framework that we used when designing our strategy for improving mental health accessibility is the observation, interpretation, and intervention framework. This framework is a three-step process: observing what's happening, noticing a problem, not making any interpretations yet, and then you go into the interpretation stage and develop an explanation for the problem you observed, and then come up with a intervention. This strategy is useful and appropriate for our problem because there's a lot of research done around mental health and like what can help people's mental health. So there's a lot of results to observe, and then there's other perspectives offered by the researchers on how we can interpret the results.
All right, so for our next framework, transformational leadership works because it obviously focuses on inspiring and motivating followers, and it also has an emphasis on inspiring positive change. The application to our strategy is the mindfulness app, which is designed to engage with students to help their well-being and self-empowerment. The focus is on community building, closely mirrors the transformative process of engaging, and why not other frameworks? Because transformational leadership is just it just better captures long term, and we want students not to just engage temporary, but also just long term.
So our strategy centers around a free mindfulness app tailored for college students, offering guided meditations, journaling features, live sessions, and webinars led by mental health professionals and volunteers. The app emphasizes accessibility, global reach, and customization, allowing users to build personalized mindfulness routines and connect with peers through chat rooms. This will be funded by student tuition contributions, partnerships, and donations. The app ensures free access without the premium cost of alternatives like Insight Timer, which is $60 a month. This provides an inclusive space to support student well-being.
So the research basis for this strategy comes from a bunch of research done on mindfulness, and basically the results of all these studies on this slide indicate that mindfulness is just overall really good for your mental health. It can help you decrease your stress. People who participated in mindfulness activities reported greater well-being and satisfaction with life. So overall, just it's a common conclusion in research studies on mindfulness that mindfulness is a positive thing to do for your mental health. And we can also see this results like across the world. These studies don't just come from the Western world. We've also found a bunch of studies done in other countries such as Saudi Arabia, South Korea, New Zealand, and Pakistan that found mindfulness practicing it regularly can improve well-being and significantly decrease stress. So overall, research suggests that it's an effective mental health tool regardless of cultural background. So it's there for everybody.
All right, so when it comes to engagement, we would want to connect with the U of M, mental health professionals, and the students. Why is that? Because the app would be funded through tuition contributions, and professionals are key in providing core content for the app, such as like live sessions and webinars. And students are obviously crucial because they would be driving app usage, and how we would generate buy-in would to offer a trial to show off the app's value for free. Also position their involvement as a chance for exposure. And lastly, for students, stress, our app is free through funded by tuition.
So our strategy in comparison to other mental health apps that are out there is that we'll have U of M mental health counselors, and we'll incorporate those mindfulness practices such as yoga and meditating, and also have some journaling and reflective prompts for the students. And then we also want to add in webinars, workshops, and recordings so students can watch them at a later time if needed. But then we can also have partnerships with different schools so we can expand like past the local level, and we can allow for other universities to join, lead webinars, etc. And then, as we've mentioned already, there is no subscription fee as it's included in tuition. So for soft versus critical citizenship, with this strategy, the soft aspect is the approach tries to promote change without telling learners what they should think or do. And that kind of relates just because mental health is not one journey for everybody. It's kind of an ever evolving thing, whereas critical, all knowledge is partial and incomplete, which also ties to mental health, as there's not one journey for everybody, but also with this CIA and LIA project, it might be lacking in the critical citizenship just because we're focusing on more of a local context rather than expanding globally.
And our strategy is realistic because mindfulness done on apps has been shown to enhance mental health treatment, and it just addresses the barriers that in-person mental health care often has. It's hard to get in-person mental health care, but this app will be free for all students. And there's already paid trained professional counselors at the University of Minnesota, like those at the Student Counseling Services. And they've been trained in mindfulness and could work with students and faculty to create this app.
So in order to measure success for this app, we'll be using user engagement metrics, which was kind of introduced by the National Library of Medicine as the best way to kind of see if the app is working. So we'll be looking at number of downloads, number of weekly users, session durations, things like that. But then we'll also look at other metrics such as App Store reviews, partnership feedback, since we'll be using partnerships for funding and things like that. And then given that we have student buy-in, we'll be hoping to incorporate semesterly feedback surveys for the users just to get more genuine and authentic responses to the app.
Overall, the context is for college students, and it's important to think about cultural considerations and lenses as well. And how we know this strategy is important is just through feedback and testing and just feedback loops in general.
And then we will connect with stakeholders through social media, newsletters, university platforms, and campus events. Our main stakeholders are going to be students who will be using the app, student organizations focused on wellness, faculty and staff who can help promote it, nonprofits like NAMI, and volunteers and donors supporting mental health. To ensure everyone feels involved, we'll host workshops, gather feedback through surveys and meetings, and work together to improve the app based on the community's needs. And then to recap, our solution is a free mental health wellness app for university students funded by tuition and donations and includes mindfulness practices, webinars, workshops, journaling, and live virtual sessions. We decided on this because there are not enough affordable resources for university students. Thanks for listening.